Each year, nearly 500,000 people receive medical treatment for burns, according to the American Burn Association. A new product is changing the way the worst of those burns are treated. In Focus on Your Health, Teresa Snow shows us how spray-on skin is helping one man heal.
Focus on Your Health is sponsored by MU Healthcare.
1 year ago, a bonfire changed Eli Beasley's life forever, but science and personal strength have made his recovery possible. Eli Beasley started playing guitar in the Marine Corps, but lately it's become a sort of therapy.
That was one thing that helped me out tremendously to get my fine motor skills back.
His life has been a stream of hospital visits since October 2018. In a moment of carelessness, this professional firefighter tried to light a bonfire with a gasoline mixture.
The flame just kept coming back and coming back and coming back. And I could feel hands on me, and I kept trying to roll towards that person.
Eli was taken to University of Missouri Healthcare's Level 1 Trauma Center with burns over 75% of his body.
A major burn patient in any one hospital is maybe the sickest patient in that hospital at that time because it affects the entire body.
Traditionally, in very large burns, doctors harvest small bits of healthy skin to grow into sheets of skin for grafting. But Dr. Jeffrey Litt was one of the first surgeons in Missouri to also use a newly FDA-approved treatment called spray-on skin. A small sample of healthy skin is taken from the patient. An enzyme is used to break apart the skin cells, and the solution is sprayed onto the wound. The cells start growing to form a new layer of skin.
The expansion ratio is huge.
Clinical trials show patients recover more quickly using less skin than with the traditional skin grafts. Eli's had more than 20 surgeries and countless hours of stretching with MU Healthcare's physical and occupational therapists. But through it all, he's remained overwhelmingly optimistic and hopes to be back to fighting fires.
You have to wake up every day and choose to pick up the pieces of your own life.
Finding himself one note at a time. Joining me now is Dr. Jeffrey Litt, Director of the Burn and Wound Program here at MU Healthcare. Spray-on skin is quite an advance. Is it for all of your patients?
It wouldn't be appropriate for all patients, but it does have clear benefit in patients with larger body surface area burns that don't have as much skin that's unburned to use for their skin grafts.
How does it make you more flexible in treating your patients?
Well, one of the standards of care is to send out some skin and have it grown in the lab, which takes a certain amount of time. To be able to do it in real time when I decide I need it rather than when it's ready in the lab really gives me some flexibility.
That's good. Here at the Academic Health Center, you are always studying the next great way to treat a burn wound. Tell me about that.
Well, we have been enrolled in multiple trials. The spray-on skin was one. We've also been involved with the trial enrolling patients looking at a lab-grown skin that could replace the need for creating a wound, i.e. harvesting a skin graft altogether.
How close are we to that?
Well, we've already been through 2 different phases of the clinical trial, so pretty close.
That would be amazing. Thank you very much, Dr. Jeffrey Litt. And with Focus on Your Health, I'm Teresa Snow.
Focus on Your Health has been sponsored by MU Healthcare.